Hi, everyone. Thank you for coming to this month's Nursing Grand Rounds presentation. We typically present these 1-hour professional development opportunities each month on the first Thursday between noon to 1 p.m. Today's Nursing Grand Rounds on connecting through interpreters is an exception, and we will end at 1:30 p.m. today. And please save the date for the next Nursing Grand Rounds presentation on prenatal diagnosis and genetic counseling, and that will be on May 2nd. We invite you to attend live at Seattle Children's main campus or remotely via video teleconference at a regional site or anywhere via webinar or web stream. Please be sure to sign in wherever you are or log in with your name and your email address. Instructions for obtaining CEs are on the course flyer. And just remember that this is a live event that's also being recorded, both speakers and audience. We want to keep these talks as interactive as possible, and we invite you all to ask questions. For WebEx or VTC participants, you are welcome to type in a question during your using your chat function, and we will ask the speaker at the end of the presentation. Following today's presentation, we will send you a link to the post-course survey where you will be able to print a CE certificate upon completion of the survey. And site coordinators, please send us your sign-in sheets. So we come together today to present to you Connecting Through Interpreters to provide the best practice guidelines for working with interpreters to connect to the patient and family. This training is originally at least 3 to 4 hours long, and through working with the Connect program, today's presenters, we were able to adapt this to Nursing Grand Rounds in the hour and a half that you're here for. Our first presenter for today is Juan Kraus, who joined our interpreter services team in 1997 as a staff Spanish interpreter. He is currently a manager for our interpreter service team. In his positions and throughout the years, Juan has combined his managerial duties with a variety of projects directed to access language services for our patients and families, and helping families with language needs to overcome language barriers have been Juan's focus and motivation. Our second presenter today is Dr. Craig Jackson, who is a neonatologist at Seattle Children's. He was previously the NICU medical director and is currently a professor of pediatrics at the University of Washington. In addition to being a compassionate neonatologist, Craig is also a workshop leader with the Connect program. So please welcome Juan and Craig. Oh, sorry. One last thing. The surveys that you completed, we're going to do a pre-survey and a post-workshop survey. When you're done, please hand it to Lena, who will be sitting in the back. Thank you.
Hi, thanks for inviting us here today. I'm Craig Jackson. As you mentioned, I'm a neonatologist here and a workshop leader in the Connect program. Just disclosure, we have no conflict of interest or commercial support to disclose. And we especially wanted to thank Jorge, who was scheduled to do this but had a family emergency, wasn't able to come. So thanks so much for Juan for filling in. And thanks to Patty, who's going to have a small role at the end in helping model or demonstrate how we'd like you to do a little bit of simulation at the end of the session. And then to Lynn Vigo, who is at a national conference on patient experience in Dallas right now and wasn't able to join us today. So here are our learning objectives. Our first is that we obviously want to explain the role of interpreters in a healthcare encounter. We want to summarize the benefits and the goals of a pre-session with an interpreter, something that personally I almost never do, and I'm learning how important that can be. We're also going to discuss best practices for working with professional medical interpreters. We're going to discuss how to work with an interpreter who's engaged in summarization, side conversations, editorialization, giving advice, etc. And we'd like to integrate effective communication techniques when working with a remote interpreter. We'll talk about those kind of special roles later on. So, Juan.
Hi, so what do you think is the role of the interpreter? Anybody? Have you all worked with interpreters before? Yes? Okay. So the role of the interpreter is to facilitate understanding in communication. That's it. And many times we, as interpreters, are put on different roles. And this should be our only role. Sometimes interpreters, as you know, are asked to be translators, to translate documents on site. They're asked to be transporters, taking patients from one side to another side of the hospital. We're asked to be to fill out forms. We're not supposed to do that. So this is, I'm not going to go through the whole thing, but this is basically what the interpreter's role should be. The interpreters are there just for the communication, okay? So these are the interpreted modalities that we have at Seattle Children's, and you probably have used some of these. These are some numbers, just to give you an idea how many interpreter sessions we have had or encounters. As you can see, the phone interpretation is humongous, over 72,500 calls in 1 year, in 2018. We also had in-person outpatient interpreter encounters over 46,000. And the family line, do you all know what the family line is? It's an 800 number that families can use to call in the hospital when they're at home, when they need information, the lab, the pharmacy, anybody. So, and for those, over 14,000 calls we got in 2018. And of course, the video interpretation, you probably have used videos at some point, and that's also a lot of video interpretation sessions, over 17,000. So, as you know, you probably know from somewhere, is over the phone we have most of our variety of languages. Last year, I think we provided interpretation in person, video, and over the phone for 103 languages total. So the phone, through the phone, you can get over 200 languages, and that's our just-in-time interpretation. Some languages might take a little longer, but the calls, the average connection with an interpreter over the phone is 36 seconds, depending on what time of at the time of day and what day of the week too. But it should be less than a minute or two. But for some languages, you actually have to pre-schedule the interpreters over the phone. There are some rare languages, they don't have interpreters 24/7 available. So for that, you can just pre-schedule. And over video, we have 35 languages. And you know that we have videos in many areas of the hospital. The ED, every inpatient unit has their own videos. And we're doing now a pilot project in the cancer unit where we're assigning a video to families who are admitted as limited English proficiency, and the video stay with them for the whole stay. So it's a pilot that we're doing, and we'll see how that goes and see if we're going to expand it to the rest of the hospital. Because we know that one of the main barriers to use interpretation over the video is that sometimes you can't find it, right? So anyway. And then for ASL, in-person interview, this is something that not everybody knows, but we have a 24/7 in-person ASL service. So you can call, you can request an interpreter ASL anytime, day or night, seven days a week, okay? Yeah, sign language, ASL. So for that, if the interpreter is not here, it's not a staff interpreter, so it takes time for the interpreter to come here, between 40 to 60 minutes sometimes, depending on the time of day. And for that, in between, you can use the video just to bridge the gap between interpreters. Any questions about this? No? Okay. And now, I don't know if you know, but interpretation and translation are two different skills. Interpretation is the verbal way of doing things, and translation is the written one. And those are two totally different skills. If you are an interpreter, certified interpreter, that's your specialty. Not many interpreters are also certified as translators. So when you bring an interpreter to interpret for you, and you ask the interpreter to translate stuff, it's a risk, because we don't know if the interpreter is capable of doing that. And it's a totally different skill. You can be an excellent interpreter and not a good translator, and vice versa. So we just need to be careful about that. we know that it's very easy to think that, well, the interpreter can translate all this for me, for the families before they go home. But no, it's kind of, it's a safety issue for us that. And of course, using electronic translators is also a bigger risk. You have no idea the translations that come back to us done over the internet. And of course, our staff is very creative, and they think, oh, I have this paragraph, I'm going to send it to Google Translate, but it's super risky. The system is not sophisticated enough still to do a good translation 100% of the time. It's getting better though, but not yet. So what else can I tell you about? Do you have any questions about this? Do you know that we have for the inpatient area a system to provide translations in 7 languages for discharge, right? Anybody knows that? So for that, let me tell you, for translations, it is a process. Somebody has to do the translation, the translator, and somebody has to proofread it and then correct it and then provide the final, product. So it takes time. And so for translations longer than 450 words that we have for discharges, it's going to take longer than 90 minutes. We have this system where the translation can come back in 90 minutes once you send it to the company, if it's 450 words or less, which is more or less what a regular discharge is, the length. But for other translations that are not discharge translations, you need to send the request to translation services. And we have a centralized service where we get all the translations, and our group of translators will send back an email to you, and they have to be sent via email, telling you the turnaround time. And all depends of the language, the length of the translation and all that. We also have over 400 documents already translated through the health education department in different languages. So you can just go to the health education database, enter the name of the document in English, and it tells you it has been translated or not and which languages. Okay. Do you have any questions about this? No? Yes? That's correct. No, we cannot do that for families. Oh, I'm going to repeat the question. The question was if the 90-minute turnaround time for translations is only for the inpatient area discharges. And yes, that's correct. It's only for the inpatient discharges. We don't have that system yet for the clinic areas, discharge from clinics. And I'm not sure that we're going to get there too soon. And families don't want to wait 90 minutes after the clinic visit to get the translation. When they're inpatient, they might. And if they can't wait, we mail them to them, but not for the outpatient area. Yes?
So in the past, working in clinic, I sent you an email with the recommendations from the clinic visit summary, and you translated that, and I've mailed it to the family. Is that an okay process to use?
It is an okay process, but we don't have translators in-house for all languages. We have only Spanish, Russian, and Ukrainian, actually. And it might take time. So if the translators are, busy with other deadlines, this discharge might take up to a week to get to the family. So we need to think about that. Yeah, and we don't have really a system for every single discharge from clinic to be translated. We would need 40 full-time translators. You see, I just say interpreter, it should be translator. So it should be, so once in a while when it's something super important that the family needs to know in their language. Oh, and that's another thing. You need to make sure that the family can read and write in that language. Because sometimes just because they are registered as Vietnamese speakers, we just translate everything and give it to them and go home and read it. And we don't know if they can read that language or not, right? So we need to make sure of that. So for your question, if it's something that is absolutely needed and it's just less than 1 page and can be done kind of quick, yes, please feel free to send it. And the translators, the team will send back an email to you with some, comments and guidelines and deadlines and all that. So, Yes. Any other question about translations? No? So, as you know, we have this, you probably know, we have this language validation test for our staff. And this is actually something that we require because the fact that somebody speaks a little bit of some language, we don't really know how much is a little bit, right? For some people, a little bit is a little bit, for some people, it's a lot. So we just want to make sure that the communication that is happening with the patients is correct. And so we're asking all our staff that if they want to provide care in a language that is not English, the language that they speak, they need to be tested. And unfortunately, we have only 16 languages that can be tested. There are the most common languages. So if you speak a language that you would like to be tested, and just send an email to language validation and language testing, I'm sorry, and then I'll get back to you with a response about the language and all that in the process. We have the process to be tested also on child under language validation. So the test is only 40 minutes over the phone, and depending on what level of, or what do you do in the hospital, there are 3 levels of tests that you can take, and you will be assigned to the right one for your position. And remember, this test is only for you to provide care directly to your patient in that language. It's not to interpret for anybody else. This is not an interpreter's test. I get that question a lot, saying, if I pass this test, can I interpret for anybody else? No. To become an interpreter is more, yeah, hold on. Yeah. Yes, if you pass the test, yes, you can do that. Yes, of course. So the question is that if she speaks a little bit of Spanish and she wants to provide service directly or care directly to her patient in Spanish, she needs to take the test. If she passes the test, then she can provide care directly without the use of an interpreter. Now, this is a word of caution. The fact that you pass the test, I mean, you can provide care, but you have to set your own limits because some vocabulary you're going to be familiar with and all that. So in that case, please reach for interpreter services and get an interpreter for that. But yeah, in most of the cases, depending on your level, you'll get a test according to your position. And there are some medical terminology that is tested and all that. But okay, yeah. Any other question? So, and if you pass the test, you get a special badge insert that it tells you, it tells everybody that you are certified validated, not certified, validated to use that language, okay? But remember, and many staff members are gonna come to you and say, hey, can you tell this family this and that because you have the badge and da-da-da? And you say, no, I'm not an interpreter. I just speak the language, but let's call an interpreter. Oh, here's the phone, or here's the video, or something. Okay? Okay. Any other question about this? Yes?
About how much of the language you need to know? Would you say, like, if you know a little bit, you would pass the test? If you know a moderate amount, you can pass the test?
You, depending on your level, you need to, let me give you a statistic. Out of 100 applicants, probably 30% pass the test. And it's a test that tests not only vocabulary, but also fluidity in intonation and all that stuff. And also a little bit of cultural nuances, a little bit, but not much. But it's not that easy. And that's what we want, right? To be just the right amount of tests for the right amount of communication. So if you go to Puerto Vallarta and you want a beer, you're not going to pass the test, right? It's just for a beer. You probably won't pass it, yeah. That's a really good question. We give you 2 opportunities, and you can take it within 3 to 6 months after the first one. And we'll give you some time to kind of practice a little bit and then take it again. But we actually don't want people to study for the test, then pass the test, and they forget all the study. So we want to test people as they are. the language level that they speak, that's why we want to test. Okay. Any other question about this? Thank you. Okay, so now it's Craig.
All right. So a few months ago, or actually maybe more like a year ago, I was asked to be an actor in the videos of being perform poorly. And I said, I can act poorly and I can perform with interpreters poorly. So I want you to watch this. This is going to demonstrate poor techniques, not only poor use of an interpreter, but also poorly connecting with the patient and family. And it's about 3 minutes long. And as you watch, keep track of what's going well. Maybe take a few notes, because I'm going to ask you at the end, what did you see that went poorly? And there's lots of opportunities to find things that went poorly. So take a big piece of paper.
Esperemos este doctor nos ayude, porque esta niña casi ha dejado de comer. ¿En serio? Y tiene chorrillo a cada rato. Dígaselo usted al doctor cuando entre. Sí.
Yes, I'll finish that when I finish here. Hi, Dr. Smith. Let's see what we have here. So this is Gabriella, who is 13 years old and has, let's see, fever and cramping and fatigue. And Dr. Swartz wants me to evaluate her for Crohn's disease or ulcerative colitis. So, how long has this been going on?
¿Cuánto le duran los síntomas?
A veces varios días, y los cólicos son terribles, y tiene el estómago bien suelto. A veces no quiere ni salir de la casa.
Just a couple days.
Como por ejemplo, el otro día nos fuimos de compras al mall y esta niña estaba dando lata que quería ir al baño y se la pasó todo el tiempo en el baño y toda la familia esperándola.
Like the other day, we went shopping at the mall, and she was just
And
whining.
she's having fevers. How high has the fever gone?
¿Y cuánto ha tenido de fiebre?
Nada más 105, pero le quita todas las energías.
Just 105.
105? Is that what she said?
Yeah.
Ask her if anything makes it better or worse.
¿Le ha dado algún medicamento?
Le doy té de manzanilla. ¿Dicen que es bueno para el estómago?
No, él quiere saber sobre medicamentos, como de la farmacia.
Pues le di Pepto-Bismol una vez, pero la hizo vomitar. Y le di algo, ¿cómo se llamaba? Diamante, diamode, algo así.
She just gave her some tea.
So, Gabriella, you've been having cramping, fever to 105, and feeling really tired. Does the tea help?
I guess.
Do you have any other symptoms?
Not really.
Dígale lo que le dije antes.
Ay, señores, que se me olvidó.
I don't have a whole lot to go on here. So I think we should do some tests. We're going to do a CBC, LFTs, we'll get a stool sample, and if that doesn't give us the answer, we'll do a colonoscopy. So I'll have the nurse come in and give you the instructions about how to prepare for that. Can you go over those with Mrs. Santana?
Sure.
All right, thanks.
Le quiere mandar a hacer unas pruebas y después una colonoscopía.
Como quiera. No te preocupes, mija. Si no te ayudan aquí, nos vamos a otro hospital.
All right. So other than the bad acting, what didn't go well? Anybody have a comment? Just shout it out. Yeah, so back turned to the patient, not to the, yeah, not looking at the patient. What else?
Wasn't addressing the patient directly?
Not talking to the patient directly,
lot of
particularly the mother.
paraphrasing.
More talking to the interpreter and said it to the mother.
A lot of like a paragraph of speech into a or two-word response from the
Yeah, the-
interpreter.
Doctor didn't really pick up on that she wasn't interpreting all the important information. Anything else?
No opportunity for questions?
no opportunity for questions.
When you were talking directly to the patient, the translator didn't have a chance to have that conversation translated back to her.
Right. Anything else?
You're,
I just said bye and left the room. All right.
there was total just disrespect.
So here's a few things that you may have already mentioned. I'll just kind of go over them. Some things that the interpreter services think went wrong. There wasn't a pre-session, so they think that's very important. Interpreters was present with the patient before the session, which is pretty common in my experience, but it has some disadvantages. Provider was not focused. Provider and patient were speaking to the interpreter, talked about that. There was omissions and additions and changing meaning going on. There were side conversations, long sentences that didn't ever get really translated, interpreted. And then there are technical terms, the LFTs and stuff like that. And positioning was poor, you mentioned that. And then kind of cutting off the interpreter when he got impatient with hearing about the shopping mall, which is logical. And then interpreter answering for the patient instead of interpreting. Tasks, being asked to do things that are outside her scope, like give her the the follow-up, read her the follow-up instructions, et cetera. So a lot of the things that went wrong there were failure to deal with interpreters correctly, but there are also things that are just bad medical practice, bad nursing practice, just bad healthcare provider practice when you're interacting with families. And so the Connect program, and we have a 4-hour introductory session on the Connect program, which you're welcome to take. I don't have time for that, but I'll give you 1 minute kind of a capsule of what the main steps are that we think are very important in any connection with patients. And in fact, I use this with my wife all the time, and she calls me on it like, what, you're using that Connect stuff again. So the first is connecting to the moment, and in this context, it means figuring out, is there an interpreter present? And then talking to the interpreter and saying, kind of, having a little pre-huddle, but also can mean just quieting your mind, like, I got to forget the other 5 things that are on my mind that are bothering me, and the phone calls and everything else, just getting ready to see the patient. Once you go into the patient is connecting to them and saying something like, oh, I notice you're wearing a Mariners hat, go 7-1 so far, So something that will let them know that you care about them as another person, not just as a patient or an object. And then connecting to their concerns. And this will be the meat of most of our interactions with families, trying to figure out what they need, what they want, what their concerns are, what they're afraid of, what they're hoping for, all of that. And then finally connecting the dots, which is just, wrap it up at the end, assure yourself that they understand what the next steps are, and in some type of politically correct way, say, tell me what I just told you, except don't use those words. Say, so what did you, if you were going to tell your husband when you go home what happened here today, what did you learn? Summarize, so some type of way of getting to assess whether they really got it or not. So we're going to break the next one, the so-called good one, into 3 parts. And so the first one is going to be connecting to the moment. And once again, as you watch, this time don't keep track of what doesn't go well. Keep track of what, well, you can do it if you want. But mostly what went well. We want to point out the things that we want to reinforce going forward. This one's fairly Okay, Gabriela Santana, 13 years old, fever, cramping, abdominal pain, fatigue. Dr. Schwartz wants me to evaluate for Crohn's or ulcerative colitis. Family Spanish speaking, and we have an interpreter. Let's see, is it in person or over the phone?
Oh, Dr. Smith.
In person.
I'm so glad I caught you.
Yeah.
Dr. Gandera's on the phone.
Ah.
And she needs some paperwork or something on the Lee girl, the baby we saw in clinic this morning, the one that needs the feeding tube.
Yeah, I have a patient to see right now. Could you ask her if I could call her back after 3?
Oh, absolutely.
Okay.
Yeah.
And do you know if the interpreter for Gabriela Santana is here yet?
Yes, she is. She's right around the corner outside the room.
Thank you. Hi, I'm Dr. Smith. Are you the interpreter for Gabriela Santana today?
Yes, I am. Hi, my name's Amalia Navarro.
Great. I'm looking forward to working with you today. So this is the first clinic visit for Gabriella. She's 13 years old, and she has some abdominal problems. And my goal for the visit is to get to the bottom of what's causing these problems.
Okay.
I haven't worked with you yet as an interpreter, so I'd like you to interpret everything anybody says exactly as they say it. Okay? And if I go on too long, just give me the high sign, so I stop and pause. And if there's something I say you don't understand, just ask.
Okay.
All right, ready?
Perfect. Let's do it.
Okay. So, what went better this time? Oh, other than the pre-session. This is the whole thing was a pre-session. Other things. If you shout it out, I'll repeat it for the audience.
Prior to entering the room, so that when
Right.
he entered the room, presumably he wasn't going directly to the computer.
Right, we did it before going in.
Provided guidance,
I'm sorry?
provided guidance or expectations.
Provided guidance to the interpreter, yeah. Very specific in what I wanted.
You had a plan of how you're gonna work with the family.
Uh-huh,
and
plan.
the new interpreter.
Yeah, let the interpreter know what that plan was gonna be.
I like the nonverbal signal that you gave her to say, you know, if I'm going on too long, just
Just,
hold up a hand.
so nonverbal signal, stop.
So she doesn't have to actually interrupt you, but
Yeah.
it's a visual cue to let her interpret.
Yeah, so visual cue rather than interrupting. Good idea, yeah. In the back?
I like that you wanted her to translate every.
Yeah, I gave her instructions to translate every word. Anything else?
You didn't allow an interruption before going in, after you, when you didn't take the call from the other provider.
Yeah, try to get the interruptions out of the way. Okay, let's see if there's anything else. Preparing, focusing, connecting to the moment. Okay, let's do, this is a little bit longer because this is the not only the connecting to the patient, but also the concerns, and this is the meat of the visit. So once again, keep track of what's going well. Buenas tardes, Gabriela. Buenas tardes, Senora. Yo soy Dr. Smith, and that's it for my Spanish.
Y ese es todo el español que hablo.
Buenas tardes, doctor.
Good afternoon, doctor.
This is Amalia, who'll be our interpreter this afternoon.
Yo soy Amalia y voy a ser su intérprete.
And she's going to interpret everything we say today. Anything you don't understand, just ask.
Y yo voy a interpretar todo lo que se dice aquí. Si hay algo que no entiendan, por favor pregunten.
So Amalia, why don't you sit over here so I can talk directly to Gabriela and the Senora.
So yo me voy a sentar aquí para que el doctor hable directamente con ustedes.
So Gabriela, who did you bring with you today?
This is my mom.
Great. So I understand from the referral that you're having, say, fever and cramping and pain in your belly and feeling really tired. Is that why you're here today?
Well, yeah, it's been hurting a lot down here.
Okay, Amalia, can you interpret what we're saying so that Mrs. Santana will know?
Yes, right. Tengo entendido por la carta de referencia que Gabriela ha estado sufriendo de fiebre, de cólicos y de cansancio. Y luego ella le contestó que también le duele el abdomen.
Así es, doctor. Pero más que nada, tiene el estómago bien suelto.
But most importantly, she has diarrhea.
Oh, I see. And tell me about the diarrhea. Like, how often do you get it, Gabriela?
Cuéntame sobre la diarrea. ¿Qué tan seguido te da, Gabriela?
La diarrea, pues a veces le dura todo el día.
Sí, pero ¿cuál es la causa?
Amalia, can you please tell me what Mrs. Santana said?
Yes, sorry. She says it can last all day.
And does anything make it better or worse?
¿Y hay algo que lo mejora o empeora?
Not really.
Pues le di Pepto-Bismol el otro día, pero la hizo vomitar. Y le di algo, diamante, algo así.
Yes, I gave her Pepto-Bismol the other day, but she threw up. And then I gave her something, some like Diamante, Diamode.
Oh, Diamode, that's a brand of Imodium. Good memory, Mrs. Santana. Did it help?
Diamode es una marca de un medicamento que se llama Imodio. Muy buena memoria, señora Santana. ¿Le ayudó?
Sí, pero le regresó al otro día y peor.
Yes, but it came back the next day and worse.
Oh, okay. I understand she also has fever. How high?
Y tengo entendido que también tiene fiebre. ¿Cuánto ha tenido?
Nada más 105, pero le quita todas las energías.
Just 105, but it saps all her energy. As an interpreter, I'd like to clarify that number with Mrs. Santana.
Okay.
Disculpe, señor. Usted dijo 105, ¿así? ¿O 100.5?
Ese.
That one. Okay.
That's a relief. While we continue to talk, I'd like to examine Gabriella on the table here. Is that okay?
Okay, I guess.
Ese es un alivio. Mientras seguimos platicando, me gustaría examinar a Gabriela aquí en esta camilla. ¿Está bien?
Sí.
I'll ask the nurse to come in during the exam. Is it okay if Amalia stays?
Le voy a pedir a la enfermera que pase y que esté presente durante el examen. ¿Está bien si Amalia se queda?
Sí.
So, Gabriella, is there anything else you can tell me about this diarrhea? What does your poop look like, and do you see any blood in it?
Muy bien, Gabriela. ¿Qué me puedes contar sobre la diarrea? ¿Cuál es la consistencia? ¿Y has visto sangre en la popó?
I don't know.
No sé.
You know, it can be really embarrassing to talk about your poop in front of people that you don't even know.
¿Sabes? Puede ser muy vergonzoso hablar sobre la popó en frente de personas que no conoces.
But let me tell you a secret. Did you know that I talk with people about their poop all day? It's my specialty. I even have a special official poop chart.
Déjate cuento un secreto. ¿Sabes? Yo hablo sobre la popó todos los días con mis pacientes. Es mi especialidad y hablo tanto sobre la popó que hasta tengo un esquema sobre la popó.
So I can tell a lot from how poop looks, whether it's hard or soft or watery. Have you looked at your poop? You know, it's really not weird at all to look.
¿Sabes? Yo puedo determinar mucho según la apariencia de la popó. Si está blanda, dura, está aguada. ¿Has visto tu popó alguna vez? ¿Sabes? No sería nada raro.
It's like that one there. Kind of mushy, but with streaks of red and little blobs of white goo.
Okay.
Sí, es como esa, con consistencia de papilla. Tiene unas rayas rojas y unos grumos de baba blanca.
Okay, that helps me a lot. I'll tell you what, there might be something in your intestine that's causing this problem. I'd like to do some tests. Then we kind of probably need to look inside your intestines.
Eso me ayuda mucho, pero creo que vamos a tener que mirar adentro de tus intestinos y hacer unas pruebas para ver qué está pasando.
So in this test, you'll be lying on a table like this. I'll give you a medicine that'll keep you completely asleep. You won't feel anything. Then we'll insert a thin, flexible tube with a camera on the end into your bottom to look at your intestines.
Durante este examen vas a estar acostada en una cama como esta. Vas a estar completamente dormida. Te vamos a dar un medicamento. Después vamos a tomar un tubito flexible con una cámara en la punta y lo vamos a introducir por el recto para ver tus intestinos.
This test is called a colonoscopy. It doesn't hurt because you'll be completely asleep. It also won't hurt after you wake up and you can go home the same day.
Este examen se llama una colonoscopía. No duele porque vas a estar completamente dormida y no va a doler cuando despiertes y puedes ir a casa ese mismo día.
This will let us know what's going on with your intestines and it'll help me help you.
Y esto me va a ayudar a entender qué es lo que está pasando adentro y me va a ayudar a mí saber cómo ayudarte a ti.
So what do you say? How does this seem to you?
So, ¿qué piensas? ¿Qué les parece?
Well, I'm a little worried about having a camera stuck up my butt.
Me preocupa que introduzcan una cámara por el trasero.
Gabriela.
It's perfectly natural to be scared about this, but the tube is the size of my finger and it's flexible and the camera at the end is very small and smooth.
Es perfectamente normal tener temor. Pero la cámara es un tubito del tamaño de mi dedo, flexible, con una cámara en la punta, muy lisa.
Si le va a ayudar, está bien, doctor.
If it's gonna help her, doctor, it's okay.
Great.
All right. Comments? You want to use the microphone or you just want to shout out and have me repeat? If you have something long to say, hold up, get the microphone. Comments?
This time around, I noticed that you spoke directly to the patient instead of speaking, correct me if I'm wrong, I can't remember earlier if it was to the translator. It's like there was no engagement or interaction with the actual patient. And she's the one who knows English, so I was a little surprised earlier, which I know was a bad example, that the doctor wasn't speaking directly to the patient.
Yeah, so comments or questions about that? Or if Juan wants to make any comments about that? This is a bit of a special situation of where the child speaks English, but the mother
Yeah.
doesn't.
Exactly. So that's what I wanted to talk about. Many times, as interpreters, we notice that the providers are talking to the patient only, and they're ignoring basically the parents. And in this case, you notice that the provider tells the interpreter, "Could you interpret everything that I'm saying?" So the mother is engaged also in the conversation, and also the provider is giving time to the interpreter to interpret what the mother is answering, because sometimes, or what the patient is also answering, because sometimes the providers ask a question to the patient, and because the patient speaks English, answer right away, and the provider continues with the conversation back and forth and back and forth. So the interpreters many times have to turn to a simultaneous interpretation, which is really the one that we don't recommend, because it's very disruptive. The one that we use is called consecutive. Somebody says something, there is a pause, and then the interpreter, there's a pause for the interpreter to interpret what it's been said. So anyway, that's another thing.
Mm-hmm.
Did you notice also about the positioning, right? The provider told the interpreter where to sit. So both the interpreter and the provider look at the patient directly, right? Instead of the patient going back and forth like this between interpreter and provider. Yes.
I think it puts the provider in a little bit of a disadvantage, because if I'm positioned in front of the patient and the mother, when the interpreter's talking, I want to hear what she's saying, and so I'm going to look at the interpreter. But that's better for me to do that than for the patient and family. And it's something that I fail to do all the time, but I know it's important, is that when the mother is speaking in Spanish, I have no idea what she's saying, but I can pick up verbal cues if I'm looking at her instead of my attention wandering around the room or looking at the interpreter or whatever. Yes?
I didn't know there was a difference, and I thought maybe I was speaking in longer sentences, but I have found myself in simultaneous interpreting where they're starting to talk when I'm finishing my sentence, and I don't know what to do in the situation. I try to make my sentences shorter, and so it sounds like that is an actual technique. And how do it's hard for me to manage the visit, and how would you recommend I help guide the rest of the visit when that happens?
So yeah, that's a really good question, and that happens a lot. We have to find our rhythm working with interpreters, right? And sometimes the interpreters, when the provider is talking too long, they have to start interpreting, otherwise they're going to forget. And as interpreters, we don't like to summarize anything, and we don't want to forget anything. So we kind of panic and start interpreting right away before we forget. So in that case, the hand signal would be really good for the interpreter, for the provider. And many times before the session, the interpreters can talk to the provider, and sometimes we talk to the provider and said, if you're speaking too long, I'm going to go like this, and you need to stop and let me interpret. But the rhythm and the interpretation is very important, like you said. When the interpreters start talking over you, it's very uncomfortable, right? And providers do that too, not only interpreters. So. But remember, you're in charge of the session, so you can stop the interpreter and say, interpreter, how can we make this better? I'm going to speak in shorter sentences, and I'm going to allow you time to interpret. And the same for the patient and the parents or whoever is there. Okay.
Thank you. I just wanted to ask a little bit more about the simultaneous versus consecutive interpretation. So can you expand just a little bit more on that? Because I've used the simultaneous when I've been talking to a teenager that's, say, 17 and speaks English, and the mom is speaking Spanish. So, you know, and I've had simultaneous interpretation going, which I would have thought would be more efficient if I'm asking, you know, when was the last time you did this, and the interpreter is asking that at the same time. But I can see that you're not necessarily fully engaging with the parent, then you're engaging more with the, maybe I'm answering my own question, never mind.
Any observations about the video, things that you liked, both working with an interpreter or just connecting with the family?
Really appreciated the fact that the provider was taking charge of the situation a little bit and saying, okay, you know, here's an issue. Let's stop right here. Can you please say everything that we're talking about? Yeah, yeah. Yeah, and I think sometimes I do a lot of telephone conversations, and yeah, finding that empowerment in the moment, I think is a great reminder in this example.
I was just concerned the fever that she said was 105, and they are using another metric system. Is that in Spanish? And that's what she was telling 105, or?
Well, I think just the translation of the words 105.
In this case, in Spanish, sometimes some families says 105, which could be 105. Or they say 100.5, 100.5, which is different. So as interpreters, when families use either one of those, we need to clarify, and that's what the interpreter was doing. Can we write it down to see what was it? So I don't know if that happens in other languages, but in Spanish happens a lot.
Mine was the same thing.
Any other comments or questions? Yes.
I liked how you asked the patient if it was okay for the interpreter to stay for the physical exam or leave. You gave her that control.
Yeah. It's one of the principles of the Connect program is just ask permission. Is this a good time for us to talk about the serious news that I have from your biopsy? Things like that, because sometimes they say, no, I am not emotionally ready to hear the biopsy results right now. Or I really want my husband to be here when we tell our daughter what the new diagnosis is, whatever. So it's always great to ask permission about things like that, because she may have had no, I don't want her here. I want to be just by myself. So yeah, that's a very, very good observation. I think that potentially, maybe Juan could comment, could put some interpreters at in an awkward situation, like they wouldn't want to be physically close to the patient during the exam because there might be a sex difference between them. And so being outside a curtain so that the child or the family member could speak up and say, that hurts, or that bothers me, or something like that.
We do that a lot. That's why we are thankful for all the curtains in the rooms, because we can do that. And the privacy for the families and patients is super important. So we try to be respectful of that. And sometimes if it's a female patient and a male interpreter, we even ask to wait outside. And then when we come in, the provider can give a summary, even though we're not going to listen to all these comments in between, maybe if there are. But the privacy, I think, is more important than that, right?
I guess I just still have a clarification for the simultaneous interpreting. So I think what I'm hearing from you is that if we have an interpreter that maybe their style is they want to do simultaneous interpreting, and if that's not something that's like working for us, then we should just stop and clarify that. Okay.
Is that something that we can ask in the pre-session that would be like very obvious and have that out of the way?
The question is whether you
the
can ask
pre-session
for
would
that.
be a perfect timing to do that. You can just say, and I prefer to work in.
And
continuous. Consecutive. That if they don't know that, wow, yeah, they should know that. Yeah, yeah.
I'm a nurse practitioner, and I had worked with an interpreter once who said the literal translation of nurse practitioner is practicing nurse. So he introduced me as enfermera especializada.
Especializada.
So I think, would you recommend in the pre-session when we introduce ourselves to the interpreter that we also state our role?
Oh, yeah.
Is that helpful?
Please.
I mean,
Yes.
I think what I'm trying to, is that correct, what I just mentioned?
Yes, actually, the interpretation or translation of nurse practitioner in Spanish is enfermera especializada. That title didn't exist in Latin or Spanish-speaking countries and many other countries. We have talked about this with Russian interpreters and Vietnamese. You know, it's something kind of a United States kind of thing probably, and then now it's expanding to other countries. But enfermera practicante, no, that's not the translation. Or, yeah, it's especializada. Yeah.
Thank you.
Yeah, you're welcome.
Anything else? All right, let's reveal what the specialist thought was going on here, going well. So focusing on the patient and family by connecting to the patient family, connecting to the concerns, recognizing his own linguistic limitations and trying to make humor of it, maintaining control, introducing the interpreter and explaining how they're going to work together, the positioning, which we talked about, assuring that everything was interpreted, stopping side conversations, using a visual aid, and explaining tests in easy to understand terms. All right. One more relatively brief video. Yes, there's a question.
One of our webinar participants. So the question is, if there is a translator that is in the room prior to the provider coming in, is there a good way to address this to have a pre-session or just complete visit without one?
My way that I'm just now learning to do is to say, I'm Dr. Jackson. I'm here to talk with you, but I'd like to meet with the interpreter first outside. You know, something just transparent and quick and simple. And then they can interpret that, and then they realize, they're not leaving forever. They're just going to talk for a second.
Correct. I agree. Yeah. You can just be transparent with everybody in the room what you're going to do. So if you need to have a pre-session, which is super recommendable, you do what Craig said, just ask the interpreter out, but you have to tell the family, I'm going to take the interpreter for 2 minutes. We're going to talk about some guidelines, and we'll be right back. And then you can have your pre-session. Okay.
I think part of the problem I have is when I work with Juan, 10 times in the last year, and I'm not really going to have too much to say, so I might tend to skip the pre-session. So I think you have to use your judgment about what you want to say. But for a first-time interpreter, I think that's pretty important. And we'll have time for questions at the end to talk about the video interpreter, which is really problematic because you can't go outside the room with the video machine, or maybe you can, but it's pretty tricky to do that.
Would it not be advisable just to have the pre-session in the room with the family? Is that?
But then the interpreter should be interpreting everything for everybody, so the pre-session would be a little complicated, right? Because the interpreter will have to listen to what the doctor is saying, then interpreting to the family what he's saying to be transparent to everybody. So it's better if you don't have to do that, basically.
Yeah, one way to get around that would be to say, hi, I'm Dr. Jackson. This is Juan. He's our interpreter today. I've asked him, that may have been weeks ago, but I've asked him to interpret everything that you say. And I want him to interpret for you everything that I say. Something like that, just to kind of let him know what's going to happen, that they're not going to summarize everything. They may have maybe experiences with interpreters elsewhere where they really did just kind of summarize. And so just kind of give them a little bit of the taste of the ground rules. All right. Anything else? Okay. Last one. This one's fairly brief.
Great. So let's review the plan. So right after the clinic, you can go to the lab to have some blood drawn.
Muy bien, vamos a repasar el plan. Después de la consulta, van a ir al laboratorio para que le saquen sangre.
And second, our nurse will come in and give you instructions about how to collect some poop and then send it to us.
Segundo, va a venir nuestra enfermera y les va a dar instrucciones de cómo colectar la popó y mandárnosla.
And third, our nurse will come in and give you instructions. If you forget anything, you can use the interpreter line to call the clinic and ask for our nurse.
Tercero, la enfermera va a repasar con ustedes las instrucciones. Si se les olvida algo, llamen a la línea de intérpretes para comunicarse con la clínica y con la enfermera.
Then our scheduler will come in and find a good date for the colonoscopy and also make a clinic appointment for me to review the results of the test with you about a week later.
Va a venir la coordinadora de citas y va a concretar una fecha conveniente para ustedes para la colonoscopía y después va a hacer otra cita para repasar los resultados conmigo una semana después.
Okay, I want to make sure I didn't leave anything out or confuse you. So Mrs. Santana, can you tell me in your own words what's going to happen next?
Muy bien. Quiero asegurarme de que no se me olvidó decirle algo o que le dije algo confuso. Así que, señora Santana, si usted me puede decir en sus propias palabras cuál va a ser el plan.
Vamos a hacer las pruebas de sangre y de popó y después vamos a regresar para la prueba del tubo, que es para ver el intestino.
So we are going to do the test, the blood and the poop, and then we're going to come back to do the test, the one with the tube, to look at the intestine.
Right on the button. I mean, exactly. These tests will help us find out what's going on so we can help you.
Exactamente. Y estas pruebas nos van a dar información para mejor ayudar a Gabriela.
So what questions do either of you have?
¿Qué preguntas tienen?
No, creo que tenemos.
No, I think we understand.
Well, thanks for coming today, Gabriela. This must be really hard. You're a brave girl.
Muchas gracias por venir hoy, Gabriela. Eres una niña muy valiente por soportar todo esto.
Gracias, Senora Santana. Thank you for bringing Gabriela to the clinic today. It's clear that you care about her very much.
Y gracias, señora Santana, por traer a Gabriela. Se nota que le interesa su bienestar.
Gracias a usted, doctor.
And thank you, Molly, for doing such a great job of interpreting today.
Thank you, doctor, for Mrs. Santana and for me.
All right. What did you like about that? Either the connection part or the interpreter part? I think I heard you say you liked that the doctor asked for the family to repeat what's going to happen next? Yeah. Kind of, so it's part of our safety thing now, repeat back at all different levels. So we make sure we're on the same page. Good.
Things were communicated very simply when you were explaining to the parent and Gabriela what was going to be done and also what to expect and then what the follow-up was going to be. It was concise and straightforward.
Yeah, good. Anything else?
Well, they can reach you using the interpreter line to reach the clinic nurse.
You talk about using interpreter line, reminding them if that's available to get follow-up. Yeah.
What is the number for families to call in?
866-583-1527.
Okay, so if they call the main operator and request that?
That's very good. Okay, I'm impressed. So anyway, this is how it works. When the families dial this toll-free number, they get connected to the vendor, the company who provides the interpreters. They have a phone language menu first, and for the 5 more common languages here at Seattle Children's, and then at the end is for all languages, just wait for an operator. So let's say they press 1 for Spanish. An interpreter, a Spanish interpreter answers the call and says, "Hi, I'm your Spanish interpreter. I know that you want to call Seattle Children's Hospital. Please get the name of the patient, a medical record number, and the name of the doctor or clinic that you want to contact to." So in the meantime, the interpreter dials the operator here at Seattle Children's. and the interpreter and the caller are on the line when the operator answers and says, the interpreter says, I'm an interpreter, I have a caller, Spanish-speaking caller, and we need to talk to doctor such and such, or extension such and such. And the operator transfers the call to that extension. Most of the time, they get a phone tree on that extension. So the interpreter has to listen to the options and tells the family, I'm going to listen to the options and see what you need. So usually it's just leave a message for the nurse or the doctor, and then they press the number, whatever number it is, to leave the message. And the interpreter says, now you can leave your message. And the mother or caller says, I'm the mother of such and such, and I'm calling for this and that. And the interpreter interprets that into English, and then that's the recording. Now, it's kind of a complicated process if you think about when I'm explaining it, but once you do it once, it's easy, and you kind of get it. And any questions about that? Yes.
The microphone.
You know, the interpreter is interpreting and leaving the message that the name and date of birth is not included in that. And so I wonder, who can we give that feedback to, I guess?
Actually, that information is already in for the interpreters to ask the families when they're leaving the message. They might sometimes forget while they're leaving the message because they have to listen to all the options and all that. But at the beginning, when the interpreter talks to the family, says, I need the name of the patient and this and that and that. So we can go back to the vendor and remind all the interpreters that that's a huge and very important information to leave during those calls. So we can do that.
So quick question. So sometimes I give the family the interpreter line, and then I say that I'm Seattle Children's Craniofacial, and I go through all of my phone number and everything. It sounds like they already know just by calling the 1866 number that is for Seattle Children, so I don't have to leave the whole slew of information. Is that right?
This is when you call a family at home, or when?
Yes.
Yes.
I'll leave a message on their phone with
And
the
this is,
interpreter, and I call me back.
yeah, I guess you need to say it because the interpreter, even though they know that the call is coming from Seattle Children's, they interpret whatever message you are leaving. So I think it's a very good and important information for you to say it. And you're right, they know that the call comes from Children's, but they're going to interpret only the message that you're leaving. So, so you need to say it.
Okay.
Yeah.
Got it.
Question in the back?
When you have a really uncommon language, one of the really lesser dialects that people use, when you discharge the patients, do you feel like they really understand how to use the system to call back?
No, and it's a really good idea to do a demo before they go home.
Okay.
And just do it yourself. Call the line, say the message and all that. Hopefully you'll have an interpreter there with you. And if you don't, call interpreter services and we'll help you figure it out.
Okay.
But you're right. It's not an easy thing to remember once they're home. Plus they have all this information leaving the hospital. Of course, too many things to remember.
Right.
But that's a really good point. When we do demos, they kind of get it.
Okay.
And
That's
we
a
let
good
them
idea.
do it.
I like the
Okay,
demo
you need
idea.
to-
That's a
yeah.
good idea.
So this doesn't happen a lot. We do MPO calls, and if we can't get a family on the line, the only time that we leave a message is the day before. Always feels a little uncomfortable. So my question though is when it comes to the vendors, because they'll be like, okay, and I'm like, no, why don't I tell you, because we have 4 paragraphs to say. And my question is if we're using the same vendor all the time, is there any way for them to have a menu? Because it feels very time consuming from a nursing standpoint to say, blah, 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 blah. These are the MPO times and stuff. Is if they had any kind of reference for this clinic, because then it would be so much easier. Oh, is this what you want me to say? Then, sometimes you're on the phone with them for, you know, sometimes an interpreter phone call like that can go on for about a half hour, just to leave a message on the line. So I guess, is there any way to have templates given to vendors?
Yeah, unfortunately, no.
Okay.
I mean, because this is not our own vendor. This company serves hundreds of companies, and the interpreters are answering calls from many companies. So they have actually, they told me, and I forgot, space for only very few lines of instructions, like 3 lines of instructions for the interpreter to read when they get the call.
Because sometimes
So-
it feels very, like, depending on which interpreter I get, it just seems some struggle more with what I'm trying to say. So, I mean, in that way, I'm trying to help them out also as you said, translation isn't always, I mean, because part of this is, it's interpretation and it's partially translation, because I'm reading what we're going to say. So I didn't know if there's any way that we can make it easier for the vendors.
Let me go back to the vendor again and see if we can do something. But we check before with them, and that's what we were told. We cannot really have templates for every clinic or every call, and the interpreters go like, "Oh, where's my template today?" So, but let me go back to them and see what
I just
they
wonder
say.
it would be helpful.
Yeah,
'Cause
of course.
it always feels clunky. And depending on who your interpreter is, sometimes you feel like, ugh.
I know. Sorry.
Because
Yeah.
it is the MPO, I mean, they're important instructions, but
Yes.
Can I
we
just
do the
make a-
best we
That's
can.
really good comment. Thank you.
Just a quick comment. I don't know this arena at all, but it does seem logical, if possible, during the clinic visit, say, this is a handout that I'm going to call you about 2 weeks from now. Keep it available because I'm going to refer to it when I call. And then when you do call, could say, do you have the handout? Yes. Read it right now and tell me if you have any questions about it. And the time of the surgery is 2 p.m. or whatever, whatever addition. So you don't have to go over every word of a long description about it. That may be inappropriate suggestion, but it's something to consider if they can read and if they can keep the thing and have it available during the follow-up.
That's a really good option. The other thing is that I'm thinking about now is, are these calls, you mentioned that these are calls when the family is not answering, you're just leaving messages there, right? Or
We make MPO calls, we usually start days ahead of time.
Yeah.
To reach families. We don't leave messages.
You don't.
The
Okay.
microphone?
Okay. Unless it's the day before. Then you leave some kind of a message. Could those messages be recorded in different languages and you just play it or something? I mean, if it's going to be a templated message.
Yeah, the only thing that's gonna change every time is depending on it's the arrival time and the MPO.
Yeah.
Saying that
Oh, I see.
the only changes are arrival time, et cetera.
Yeah.
Go ahead.
That's gonna fluctuate.
Yeah.
There is a piece that, yes, that is.
If you're going to keep talking, you just need a microphone because there's people on the line. Go ahead.
I mean, there is a piece of that could be very helpful, but then the ambulatory clinics that are providing or saying we're gonna, get an MRI or PET scan or whatever, need to provide that, and it would be further training, but it may be helpful. It's possible.
Thank you.
So similar in terms of like time constraints, I wonder if there's any suggestions on how to most efficiently like use an interpreter, because I always feel like you're saying everything twice, it's like they take longer. And when we have clinic templates and we're trying to stay on time with everybody, and I want to make sure that I'm providing my patients who don't speak English as a first language just as good of care as my patients who do, but we're given only the same amount of time for both, it's really tough. Like, has the hospital looked at that with this Connect program? Is it something that we're able to try to do something about, or do you have suggestions on how we can make it as absolutely efficient as possible? Because if my template's 30 minutes and it takes me 30 minutes to do a visit with someone who speaks English, I can't do the whole visit in 30 minutes with somebody who doesn't.
I agree.
Do
Need
you know
more
if the
time.
hospital is doing something about this?
Yeah, the hospital needs to plan you to have more time. I don't know there's any way around that. I mean, you can try to make it
Oh,
efficient.
Patty.
It may not take twice as much time, but it's going to take more time. Yeah.
There's
We're
a-
going to.
Patty, there's a microphone over there.
One, One last comment, Patty.
Sorry, thanks for that question. I think it's an important one, and yes, it has been addressed, so it's being discussed. I can tell you that. And yeah, so I think it's important that everybody knows that, we continually try to improve these services, and that is a barrier, and we do recognize it. So thanks for raising that.
Well, just to finish out this part of the talk, just the things that went well during that last session, reviewing the step-by-steps, ensuring the family has access to information, checking for understanding, avoiding slang, asking not, do you have any more questions, because that's a yes-no answer. What questions do you have is more likely to stimulate an actual question, and then thanking the interpreter. All right. One.
So now, how would you do all this with video and phone, right? So with the video, have any of you used video? Yeah. So it's basically like if you have a person there, but it's just on a TV, right? So the positioning should be the same. The video should be on your side and the patient should be in front of you and the interpreter. Because the interpreters get a lot of facial cues from the patients when they're talking to see if they're understanding, to see if not. So they need to be looking at the patient and really not looking at the provider. They don't really need to look at the provider. They just need to be able to listen to what the provider is saying. So the position is the same. The pre-session could be the same. Like Craig was saying, it's hard to have a pre-session if the video is already inside the room, but you can still do it. You can still say to the interpreter, please tell my patient that I'm going to have a pre-session with you for a couple of minutes, a minute or two, and then we start the session. And then you can start talking to the interpreter about whatever you need to. I mean, if the video is already inside the room, it's really helpful, and this is something that I wanted to mention, for the interpreters to have the pre-session. It's really something very valuable because interpreters go to appointments blind, right? They don't know what's going to happen in any appointment. So that pre-session is going to start telling the interpreter, oh, the session is going to be about diabetes. And even if it's 1 minute, you start thinking about your diabetes vocabulary and how this is going to work. And so for the interpreters, it's really helpful. For video interpreters, even more helpful. They're not even inside the room, so that helps. And phone interpretations, you need to be, you need to spend a little more time describing the context and who is in the session inside the room, because they can't even see who is inside the room. You need to see the mother is here. I'm interpreting for her, 2-year-old girl. The father is also here. And actually, the grandmother is here, but she speaks English. So I'm going to tell everybody to speak one at a time so the interpreter can interpret for everybody. And sometimes the interpreters over the phone, and I've heard this, they said, hey, wait. Can you speak one at a time, please? Because that, as an interpreter that's not seeing what's going on, is very important, right? So, any questions? Oh, and ending the call, the same thing, like you end the call with not the call, you end the session with an in-person interpreter doing all the connect kind of stuff, right? Any questions about that? Nope, okay. So this is basically the same that I was telling you, in-person interpreters, and somebody mentioned about you being in charge of the session. You are in charge of the session, and we want you to feel that, to empower you to do that. So you need to briefly interrupt the session if something is going on, and the interpreters are not going to get offended, and if they do, well, too bad, but it's up to you to make the session work, right? So you can redirect the interpreter at any time. The same phone and videos, basically the same principles. Anything else? No? Questions? Yes? Yeah. Oh, so the question is if the interpreter knows the family and they're having a conversation while the nurse is not in the room or something like that, or even in the room. Or they're
Thought it was
waiting for
projecting.
something?
I'm from speech therapy, and so sometimes we have to wait for, I don't know. There's just
Yeah.
a little, and they're friendly with them because they've been working with them
Yeah.
for months or whatever. So A, is that okay? And B, I feel like it's okay for me to say, hey, that's fine if you're chatting, but let me know if it's something clinical, and then we return to like our serious work and stuff like that.
Well, that's the tricky part, and for the interpreters too, because the interpreters don't want to be rude with families. As interpreters, you don't want to get too close to families because then you lose your professional, attitude with them. I think that, and you see that interpreters should never be with the families by themselves inside the room without a provider, because these kind of things happen a lot. And to avoid that, the interpreter is not provider there, the interpreter is out. When the provider is there, but you're waiting for something and the family is chatting, the interpreter should be transparent about that. And you can ask the interpreter, like this redirect interpreter, you say the interpreter, if you're gonna have a personal conversation or something not related to the appointment, just let me know so I know what this conversation is about. Hopefully they won't do that, but as I said, they don't wanna be rude to families, and sometimes families try to have conversations with interpreters all the time. In fact, sometimes families prefer to have certain interpreters because they're more chatty than others, and they entertain families more than others. So that happens. But yeah, you feel free to remind the interpreter that they need to be transparent. Okay. Any other question? No? Okay, I guess.
So we're a little bit short on time, but we're going to try to do a quick demo. Patty's going to help with this. After this 3 or 4 minute demo, we'll ask you to get together in pairs and just kind of do a quick practice. So kind of envision in your mind what this might look like. All right.
Hi.
We're just chatting among ourselves here.
Hello.
I love that.
So who's our interpreter today?
I am your interpreter.
Oh, hi. Thanks. Nice to meet you, Leonore. So I'm going to step outside for a second and just chat with Leonore, and we'll be right back.
I'm going to step outside for a second and chat with Leonore for a couple of minutes and be right back.
So thanks for being here today, Leonore. So I'm running a little late. How long did they schedule you for to be with me today?
I was scheduled for 1 hour.
Okay, well, I'm a little behind, so I may need you a little longer than that. How long can you stay?
I think I can spare another 20 minutes at least.
Okay, great. That's really helpful. So this patient is a newly diagnosed diabetic, and so I'm just going to be telling him a little bit about what's going to come so we can get him ready to go home.
Okay.
Have you interpreted for a patient that has diabetes before?
Yes, I actually have.
Okay, great. Thank you. And I prefer to have you use consecutive interpreting. Are you comfortable with that style?
Definitely,
Okay,
yes.
great. Let's hustle back in. Thanks. So, Leonore, would you mind sitting here next to me? This really works a little bit better for the conversation flow. Thanks. So,
I'm gonna sit
Craig.
right next to the provider.
So, Craig, I just wanted to give you some information about what's going to happen so we can get you ready to go home.
So, Craig, I'm going to give you some information so that I can get you ready to go home.
So, the nutritionist will be coming to talk to you about the foods that you like and the foods that you don't like, and the nurse will be coming in talking to you about how to measure your blood sugar and get you ready to go home. So what?
Excuse me, just a second, please.
Oh,
sorry.
Sure.
This is from work. I just need to answer this. Hello? Yeah. Oh, yeah, I'm sorry. Yeah, I'm actually available, but I'm busy with another provider, in another appointment. Could you call me back in another 30 minutes?
I'm so sorry.
Or I'll call you right back. I'm so sorry. Thank you. I'm sorry. Sorry.
So would you mind turning that off while you're in our appointment today?
Oh, yes, I'm sorry. I should have turned it off before I walked in.
Thank you. So tell me, what questions do you have so far?
Please tell me, what questions do you have so far?
Okay, the end.
So, in the last couple of minutes, just find somebody next to you, and just, you're not gonna have, you don't have to walk around, but mentally talk to each other about, if I'm the provider and you're my interpreter, this is what I'm going to say. And if you actually say it, if you actually say it out loud, it'll stick in your brain a little bit better than if you just pretend to say it. So actually use the words. Hi, I'm the provider. What's your name? And then after about 2 minutes, after you've explored that a little bit, change roles so that the other person is a provider, and you can just kind of mentally go through how you're going to begin your next interpreting. Go for it. You got 4 minutes. All right, we're going to bring this to a close. Just wanted to see if there's any questions that came up or comments that came up during this little simulation that you'd like to finish. We have time for just a couple of quick questions. We'll get a microphone to you here.
So not necessarily related to the pair-up, but I noticed in the demonstrations that you spoke just a tiny bit of Spanish when you were introducing yourselves to the family. Is that acceptable? How much is too much? Like it seems like a gray area.
I think it is, yeah, it is acceptable. Actually, families really appreciate that. They love it, yeah. And if it's social, feel free to do it, yeah. As long as there's nothing clinical or technical or something involved, yeah, feel free to do it. They really love it. They like it, so go ahead.
There's a risk in doing that. They might start talking to you and you have no idea what they're saying.
And you need to stop that and say, well, like Craig said, that's all my Spanish, so, right? Yes.
Clarify consecutive interpretation? What?
Is the consecutive interpretation where the interpreter is basically speaking at the same time as the provider?
Oh, that's simultaneous.
Oh, that's simultaneous. Okay.
Yes,
And
simultaneous.
Then, so then consecutive
is,
would be I say something and then they interpret.
Exactly.
I say something.
That's
Okay, so if I'm talking like this and the interpreter is talking, that's simultaneous. Both people
Correct.
talking at the same time.
Correct.
Okay.
Yes.
Just a quick comment about family-centered rounds. I work in the NICU, and it is a catastrophe to have families who speak English at present during rounds. Frankly, they don't get it. You know, there's 5%, 10% of them understand what we're talking about. The others are mystified, don't know, confused, fright, in fear. So I encourage them not to come to rounds. That's my own personal preference. And if they speak another language, asking Juan to simultaneously interpret what I'm saying through all of those rounds, you know, it's going on, and we're using words like NPO and stuff. How would you interpret all that so fast? So I think, once again, I think they're going to get more confused. I'd much rather say, I'm going to meet with you after rounds with an interpreter, and we'll tell you what the key things are. But that is, if you're going to do it, that's a role for, I think, simultaneous interpretation, so that they can be, at least, you know, Juan could tell them, well, they're talking about the feedings right now and saying it's not going very well. And then now they're talking about the heart problems, you know, something like that. It's more of an interpretation, but I think it puts them in a very awkward position where they can't actually interpret everything that's going on.
Exactly. And especially when two doctors are talking during the rounds, because they not always talk just directly to the patients, but they talk among themselves, and the interpreter is saying what one doctor is saying, and then they have to say, and then the other doctor answered, and then the other doctor answered, and the other. So it's so confusing doing simultaneous like that. Simultaneous works for like the United Nations kind of thing, right? Where there's only one speaker, and you're interpreting that for everybody. And I don't know if you have noticed, but those interpreters are inside some cubicles where nobody can listen to their voices, basically. And people are wearing the headsets. So for that, it's good, but not for this setting as medicals. No, it's not good. Oh, yes.
So I just have a question for clarification, just so I get it directly from you. Is my style has always been, I look directly at the family when I'm speaking to them. I don't look at the interpreter, and I look at the family when they're speaking. I don't look at the interpreter.
Correct.
That
that's
would be
perfect.
I feel that
that's how it. Yeah.
Okay.
That's how you make the connection with your patient. The interpreter is just your voice.
Right.
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 Okay.
Yeah. Thanks for clarifying that. That's a really important point. Any last one question? All right. Well, you've been a great audience. Thanks so much for all your really good questions. Bye-bye.
Thank you so much, Juan and Craig, for the beautiful presentation today. Just a closing statements. I think from all of your questions, we know that we're all affected by this. We all deal with families who speak another language, and really reiterates the value of an interdisciplinary approach and effective communication, whatever language that may be, to promote health equity. Right. So along the same theme, this year's Nursing Research Symposium centers on the theme of advancing health equity through nursing research, and this is on May 10th from 8 a.m. to 4:30 p.m. So if any of you are interested in moving forward with this, applying learning how to apply nursing research to advance health equity, that symposium is open for registration. And just to close out today's presentation, please hand in your pre and post survey to Lena in the back row there, and look for an email from us for the course evaluations for Juan and Craig. And after that, you'll be able to obtain your CE credit for attending today's nursing grand rounds. And site coordinators, please send your sign-in sheets to Lena, as well as the pre and post surveys. The pre and post surveys that we sent you today, please email them to Lynn Vigo at Seattle Children's. Thank you.